So welcome everybody on this almost looks like spring kind of day. I'm Jeff Jagger. I'm your host for Cancer Prevention and Wellness. It's brought to you by the Cancer Survivors Park Alliance. Tonight, we are thrilled to have a couple of practitioners in ancient practices of health and healing. So we'll be meeting Peggy Ambler and Zachary Fant to review the fundamentals of their respective practices of movement and meditation and mindfulness and the ways that we can incorporate those ancient health and healing techniques into our everyday life. First, a couple of housekeeping things. I don't know how well it's working, but you all, I know you all are on mute, but we're supposed to be centrally muting you. So we would like it, if possible, rather than asking any questions, to just use the chat function. We are open to questions. This is supposed to be very conversational. And the presenters know that we want to leave time for question and answers at the end as well. The other thing is that we have some people live, and we appreciate the people making time for this when we're actually recording it, but this will be within 24 hours on the Cancer Survivors Park website, which is cancersurvivorspark.org. With that, I will introduce our first presenter, who is Peggy Ambler, and Peggy does a lot of things for the community, as well as the cancer community, as well as the cancer survivors community. She is almost embarrassed by the number of titles that she has, but she's a certified yoga therapist, and that certified should not be just skimmed over. There's a lot that she has to go through to have that designation. She's also a physical and massage therapist and does some lymphedema therapy with her yoga work. But Peggy, I heard the word yogini. I had never heard that as far as a practitioner of yoga in the past, but I don't know if that's ever anything you've ever been called before or not.
It is. Yogini actually is the female term, and yogi is the male term.
Okay,
Although,
yogi.
I don't know, maybe that's changing in this
You're a yogini
world. I am a yogini.
What is your pronoun, right?
That is my pronoun. Yes, thank you for having me and for having Zach. I'm actually looking more forward to learning a little bit more about what Zach does as well. I'm gonna, Laura's getting my slides up for me just so I don't have to. So I, like Dr. Jagir said, I do physical therapy. I'm a PT assistant and I'm a lymphedema specialist. So in those realms, I'm in the traditional medical world. And then on the other more alternative side, I do massage, Thai yoga massage, and yoga therapy. So I like to bridge the gap between all of those things and be an integrative practitioner. So today we're talking more about yoga specifically. And I'm here to give you my thoughts about yoga as an ancient practice that can affect your health and healing. So whether you are a cancer survivor or you are trying to prevent a diagnosis, or you're here to help yourself heal as the caregiver, I think all of those people can benefit from yoga and yoga therapy. So I like this meme because the before yoga is a horse and the after yoga is a unicorn. And it's such a time piece for our culture, but it also represents how this modern culture is recognizing the real benefits of yoga, and not just whether you did an exercise class, because that body of the unicorn to the horse did not change. It's not just about being a physical practice. It's about how you feel after you've done a yogic practice, which doesn't even have to be about postural work like you see in a yoga class. I think it also leads us into, okay, as the generations change and our cultural progress happens, why do we keep coming back to yoga as a way of healing and presenting better health techniques? So yoga is a practice in discipline originating from India or Hindu culture. But at the same time, it does not have to have anything to do with religion. So in the South particularly, I think there are some people that are a little nervous about using yoga, and maybe it doesn't align with what their church teaches. I think sometimes your medical practitioners don't really understand that yoga has all these other limbs besides whether you can stretch. And so that's where this second part of yoga comes into play. And yoga therapy has been around just as long as yoga. That's when in ancient times you chose a certain guru that you felt comfortable learning from. And maybe over time you would pick a different one to learn from. But just in recent times, we have developed a body of people that will license and set aside parameters for what a yoga therapist is and how you're able to call yourself that. So yoga is also a system of health, taking into consideration the body, the mind, and the spirit. It can include physical, mental, and spiritual exercises. It doesn't have to be associated with any one religion or any at all. Yoga therapy has more recently been defined as a process of empowering individuals to progress toward improved health and well-being through the application of these teachings and practices of yoga. Yoga was first mentioned in the ancient text called the Vedas in 2500 BC, and the oldest archaeological evidence was excavated from the Indus Valley in 3000 BC. So that's a long time ago. Yoga's been around for a very long time. And like I said, we keep coming back to it and finding ways to take the pieces from 8 different limbs and incorporate them into our ways of healing and make them mesh right along with the medical practitioners that you're seeing.
I guess you could say it's withstood the test of time.
It has.
Yeah.
So we don't need to go through, I don't need to read all of these on here, but this is to give you more of an idea that yoga is more than just posture, which is what most people think of. Can I stand on my head? Can I do a warrior pose? Can I stand on one foot? Will it help my balance? Will it help me with flexibility? Will it help me with strength? Yes, 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 all of those. But even if your physical body can't do those things right now, you can concentrate, you can work on your focus, you can work on whether you can meditate, you can work on the quality and the length of your breath. And all of these things in the first 2 sections called yamas and niyamas. Those are your contracts of how you live for yourself and how you live within the community. So all of these things together make yoga. Number 5, the withdrawal of senses. That's more about moderation. So you're already hearing some of these things from your doctor, your nurses. How can you change your diet? Can you lessen, maybe some people say if you would eat less meat and less cheese, there's more scientific research of how your body will respond to your treatments, how your body and your mind can change if you drink less alcohol or less caffeine. Those kinds of things are part of the yoga 8 limbs. So this slide is very different than the horse and unicorn slide. It does look more like postural work. But if you can look at it with a little more detail, you do have some upside down figures. You have somebody levitating. So that's a practice in concentration. You have someone over on the left side. One gentleman is either standing in fire or he's trying to heat his own body temperature, just like you would use a hot pad or a cold compresses. There's another one using the elements and he's in a bath of water. The truth is, a long time ago, before all these postures were put together and you had the sun salutation and all these sequences that are supposed to do back healthy or hip openers, heart openers, all of those things, you would go to a guru and you would say, here's what's wrong with my life. Tell me how to make myself better. And he might say, I'm going to make it more modern. Take a jug of grapefruit juice with you up to the mountains, sit for 30 minutes every day at noon, drink grapefruit juice, go upside down on your head if you can, leave all your clothes up there, burn them, come down, swim in a certain river, and then see me next week. That would be your yoga assignment. It really did happen that way. So if you don't know that though, and you don't know some histories, then it doesn't pull in all these pictures of this slide. So I kind of wanted to show this one. And I think those practices do still happen as well, just maybe not here.
Hanging from a
Zach, I don't
branch.
know. Zach,
Hanging from a branch happens. Hanging from a branch.
Yes, that is a study in nature, probably. But
Wow.
I go on my property and I do some asymmetrical yoga for my balance, and I'll stand one foot on one rock and one on another, and just sort of invite the breeze and focus and concentrate on what I feel and what I hear. And you could do this for 2 minutes and you come away feeling differently. Zach, I'm sure you have some different but similar practices to energy work, I guess. So let's see. These next 2 slides, the first one is about just general possible benefits of yoga. The next one is more pulled from scientific research projects. So I wanted to have those almost side by side, and we could go back and forth if we wanted to, but then also look at how yoga can benefit anyone if you look at these, but then also how much it can benefit a survivor, someone going through treatments. And that next slide pulls that in more. So you have these things like flexibility, strengthen the muscles and the bones. What are we doing with our blood flow? And it's not written in here, but also the lymphatic flow. So anyone on this class that's working on their lymphedema, you know that if you move your arms and limbs and do some bouncing or trampoline work. That's how we're getting that lymph to move. It's a sister system to the blood flow. Coordination, balance, but not just those physical pieces to yoga. We also have this stuff about managing new or reoccurring pain. And we know that also can include the neuropathy that so many of my yoga therapy clients, and if you've had the radiation and chemo, everyone across the board, I don't care what cancer they are surviving, how old they are, how young they are, every single one of my yoga clients here at Prisma or at Cancer Survivor Park had some complaint of neuropathy, which I lump into this, how do we manage the new or recurring pain, even if it's not like pain and tight skin and things like that. Balancing the endocrine system, helping you to focus. So I used, when we spoke earlier, I used a focus of nature. If you can sit outside and watch the ants carry a crumb across your parking lot or across the windowsill or something like that for a few minutes, how do you feel after you've focused on that for 2 minutes instead of your pain or your neuropathy or deciding what your next step is? If you can come away from all of that, that's your yoga. That's your yoga session that day, is to work on your focus and work on positive thoughts with everything that you're going through. So reducing your anxiety and reducing chronic illness are the next couple pieces after the positive thought. Achieving better posture, realizing deeper sleep. So I did the YOCAS research project for Butternut for Prisma. And actually I was getting ready to run that a third time and was going to run it for Spartanburg also, but the study closed. They had enough evidence-based information to close that study completely. So I didn't get to run it a third and fourth time, but that project dealt mostly with how sleep was interrupted when you're under cancer treatments, and whether yoga could affect that. And there, you can look that up, YOCAS, and you can see all the research that you want to about that research.
A number of studies were reported out of that research from the University of Rochester.
Yep.
And what kind of yoga did they do? Can you recollect? It was a very mild, gentle.
It actually used some, so I didn't write that program. I've written my own research programs as well and sequences, but with that one, they interviewed me and I used a specific sequence. Okay. And I used specific wording for how to cue breath. They had very specific cues they wanted me to use with each posture. And it's been a while. I should have brought that, or we can do another one on that someday.
Well, I should remember it too. So.
And so there were certain breaths and there were certain postures, and it did incorporate a lot of restorative. You stayed in the pose a while and you focused on that posture and you focused on your breathing during that posture. And towards the end, your legs were up the wall, and can you open your chest? We used lots of props though, so that you were not in pain, that you were always supported.
Right.
So sleep was, and probably body awareness, those two were very important in that study. Here's the research slide. So a lot of these, we don't have to go over all of them. A lot of these, I think, are similar to that first list. They just sound more scientific. But they say the way yoga might help is because it acts like a self-massage, either by contacting your own limbs, right, in certain places. It might not even be this crazy eagle arms. It might be a matter of finding a yoga mudra with your hands. And when these two touch, each finger and thumb have their own elements. So you're using some energetic points of touch. And Zach might, I'm interested to see if Zach does some of that too with when he presents his Qigong on someone. I'm very excited about learning that.
She just unmuted me. I just want to comment that, like if you look at the energetic meridians on an acupuncture doll,
Yes.
Each finger, exactly as you just said, is a specific organ meridian comes to each finger.
Mm-hmm.
So you're actually accessing different organs or energetic qualities.
Mm-hmm. So am I speaking again? Or do you
Yes.
Okay. So I actually, when I do my yoga therapy classes or individuals, I go into all that. I teach people that. And when I massage somebody, sometimes I'm not just beside the table. Sometimes I climb up on the table and I form a mudra over the top of someone. So I think Zach and I probably do some similar things and just have no idea. The other things that I might mention on this slide, not to take too much, lesson pain syndromes and nausea was included in that same line. In the reference were two different, actually, oncology volumes. And one was nursing and the other was complementary practices. So those are listed at the bottom of this slide if you wanted to look more in detail, but nausea was included with the pain syndrome in this study. Boosting autoimmune and immune systems and lessen fatigue were all sort of talked about together. So, which I think goes right along with the lymphedema health as well. And you may or may not know, but 70% of your immune system, they say, is gut health. So I think pulling in some of these other things of your sleep quality, anxiety, and your blood glucose level and your hemoglobin levels and what your blood pressure and heart rate are doing, that can all tie into your diet as well. So I just thought I'd pull all of those together in this slide. And I'm a newly lymphedema certified person, but you don't have to be certified to do that work as a physical therapist. But sometimes you just don't understand it to the same detail. It's a lot of money and it's a lot of time to become a lymphedema certified person. And so now I use that in my yoga, in my massage, in my physical therapy practice. And we use a computer program that's not part of Prisma, but it's called HEP2Go. And it has all these exercises. So if you're a knee client or a shoulder repair, I can go on there and pull all these exercises and print you out a piece of paper to take your exercises home. But they don't have anything about lymphedema. So in my role right now, I'm trying to set aside some time to build exercises, breathing, strokes that you can do for yourself to improve your immune system and help with lymphedema if that's one of your concerns. So lymphedema, or the lymphatic system, doesn't have a pump like the cardiovascular system has a heart that moves the fluid. And I said earlier, the lymph system is very intimate with the cardiac system. So it pulls off these impurities, they go into the node, and the regional lymph nodes look at it like a scientist, aha, and they keep it there. They keep the abnormal cell or toxins, and they decide what needs to move on and how we need to recognize this if we see it again, those kinds of things. Which is, Dr. Jagir, you could talk on this another time, but maybe that's how this vaccine is supposed to work some, is to train our body, but I don't know that, but I'm just thinking about that.
But you know, Peggy, it does make sense for repetitive movement, gravitational stuff, to help from the standpoint of lymphedema.
Yes.
I mean, we had, when we were talking about nature and its healing power, we had a group from Cash for Recovery, which was basically doing fly fishing to help with because that movement of the back and forth movement of the arm was helping to mobilize that fluid.
Right.
So I think there's a lot of applications that we could see with specific movements.
So yoga postures, where you're moving your arms, breath work, where you're moving your diaphragm that looks like an umbrella, and it flattens and peaks back up. Help move that lymph from extremities, or even, you know, if it's facial, right? I recognize some of the names that are on here. You know who I'm talking to. As you do those movements, it brings the lymph into the venous angles and or the trunk, where most of those lymphatic, there are more nodes and larger nodes in the trunk. So, God, this on my slide looked very dark. So it's just somebody in Savasana, which is our last pose of the practice, usually, where we just let go of all of the craziness and let go of the need to count our breaths, let go of the need to move and stretch and all of that. So I wrote the diaphragmatic breath practice and used this little picture from HEP to go, but I copied it and put it on the next slide, or we can send it as an attachment like this if people want. And I meant to already talk to LC about that, but the reason that the deep breathing or diaphragmatic breathing is supposed to help so much with the lymphedema, and you know, I never heard this in my class. I did my own research after, and I had this aha moment, like, well, that's why. So your cisterna chyli, which is moving that lymph, that actually pierces the diaphragm. So as you breathe, it squeezes that. And that's why the breath is so important with the lymphedema. And that breath is one whole limb of the 8 limbs of yoga. Just breathing. You can buy books and books you can study for years, just breathing. Whether it's deep breathing, whether it's ujjayi, making big sounds with your breath, whether you breathe in for 3 seconds, hold for 2 seconds, breathe out for 5 seconds, all those patterned breathing. But this particular breath, the diaphragmatic breathing, is what we use in lymphedema, and it's part of yoga.
That's great, Peggy. Thanks so much. There's likely some questions will come in. We'll go ahead and move it over to Zach. I don't know if my video is going to work, but as my family said, I have a better face for radio anyway. So I'm going to introduce Zach Fant.
It's Fant.
Fant, not font. Fant, like
From
elephant.
I hear it's French Lafont.
Lafont. Okay, and Zach is a a Qigong therapist, and a structural and body work therapist, and a medical massage therapist. I've just gotten to know him. He is very enthusiastic in his practice as a practitioner. And I think you'll sense that enthusiasm as he talks to you about his practice and going forward. So thanks so much for being here. Thanks so much for what you're doing as an integrative practice for our people.
Yeah, thank you very much for having me, and thank you everyone for coming. And even if you're listening later, thanks for showing up. So I'm going to keep talking. Just let me know if my volume's not good, but I think we said it's okay. So yeah, my name is Zachary Fant. I don't have any slides today. I didn't premeditate it that much. However, all the slides that Peggy put up, you could really just put Qigong at the top. So I've been thinking about this for about a week or two. There's so much overlap between yoga and Qigong. You really got to be a scholar to kind of decide what's what. And so I'm just going to, with the time I have, give everyone sort of an overview of what I think is important, give you a little bit of history. I know yoga is more of a household word nowadays than Qigong, so I'll elaborate a little bit on that. And Dr. Jager asked us a few questions the other day that I wrote down that I thought would give me a really good outline. So, yeah, my name is Zachary Fant. A little bit about me. I've been doing Qigong about 10 years. I started toward the end of my college career. I went to University of South Carolina for math and statistics. So that was a different story there. But I started having health problems, and conventional doctors were not able to help. They didn't know what was going on with me. And I inadvertently stumbled upon a book or two with Qigong practices in it. I don't even know if it used the word Qigong or it used an old spelling of it. And I was able to heal myself, remediate my problem. It was a heart problem that actually took a few years to resolve, but I was immediately able to decrease the frequency with which it was happening and the intensity of when it would happen. And so it took me a few years to kind of unravel or unkink that issue. And when I started, it was just from a book, so I didn't have teachers. But since, in the past 10 years, I've sought out handfuls of teachers and just trying to figure this thing out, because for me it was, I've got a problem. I went to the doctors. They said, we don't know. And then it was back on me. Like, oh my God, what? Okay, so now I've got to do it. And so that's been my journey, I guess, for the past 10 years, is trying to chip away at this. What is this? So Qigong, the word Qigong is probably like the word pranayama. Qi is breath or energy, same as prana in the yoga. The gong is skill or discipline. So a gong is anything you've done over time. So like we all have gong in driving a car, unless you don't drive. So a gong is just any skill or discipline that you've cultivated over time. So the word itself, Qigong, really would just mean breath work, kind of like pranayama. However, and that's what it means when you say it to a Chinese person. You say Qigong, they think, oh, you're just doing breath work. But this kind of goes back into what Peggy was saying. We've come to appropriate a lot more, at least in English speak. Qigong is more than just breath work. It includes movement, postures, mental regulations, so visualizations, meditations. And it's been around about the same time. So India and China are, right on top of each other. And so inevitably, India and China had, I'm sure, endless trading of ideas. And when we talk about Qigong, we're really, so just sticking within the Chinese context, try not to talk about yoga too much. Qigong is Chinese medicine. So the sort of the Chinese medicine we know nowadays, like if you go to an acupuncturist, is the Chinese medicine that started a little over 2,000 years ago. And some things have changed, but I think as Dr. Jagar said, it's something that stood the test of time. So there have been little upgrades and big upgrades, but mostly they're keeping the same base. So the history of Qigong goes back, we could say probably just like yoga, and even, in Europe, they talk about the Druids, to just ancient shamanic practices. If any of you are familiar, people say the shamans were the first doctors, musicians. The shamans were basically the first, I guess, really smart people. They did medicine, they did dance, they did music, they looked at the stars, they understood the sciences. That's what they were interested in. Is Qigong the same as Tai Chi? So Tai Chi is a Qigong. It's an outgrowth of Qigong. Tai Chi is a martial art. Qigong's got a little broader implication. So I do Tai Chi, and Tai Chi is a martial art. And some people try to say it's not, but that's the history with Tai Chi. Is it started as, how do I defend myself? But not only how do I defend myself, but how do I move my energy, regulate my energy? And that understanding came from Qigong. So Tai Chi came much, much later, but it used the understandings of Qigong to develop a martial arts system. And so I do Chin Tai Chi. So there's 5 or 6 styles of Tai Chi. And then they say there's over 3,000 forms of Qigong. And that's just sort of a big number. And what that means is Qigong operates more on principles. So if you understand the principles, you can really make your own Qigong. And 3 of the big principles, I would say, they're really called the 3 treasures of Qigong, is Jing, Qi, Shen, which is body, breath, and mind. So mentioning yoga, body is posture. We have postural regulations. There are certain things, and yeah, depending on what your problem is, that's part of the medical Qigong, is we want to get more specific to help an individual. But so the Jing, the body, the posture is one treasure, this body. The Qi, the breath, is the second treasure. That's the energy. So we need to get our breath work aligned. We do our postures first maybe, and then add the breath. And then the third treasure is the mind, or the spirit. And people often say body, mind, spirit. So if we were going into a lesson on Chinese language, you actually can make a distinction between mind and spirit. Spirit being the original mind, and mind being what we call the acquired mind, so the personality. However, those are generally kind of grouped as one thing. So we have body, breath, mind. or physical matter. Physical matter. The breath is the energy, the wave, if you understand physics, and then the mind or spirit is the field. So everything exists within this mind field. And then within that, we have movements, which is the chi or the breath, the movement through that field. And then the particle, the physical particle, is the body, it's the physical. And, I think modern physics is sort of the thing to look at for all of this, but then medicine and biology are kind of catching up. And so if we realize that everything is contained within the field, we realize that everything is contained within our mind. And that's one of the main points I want to drive home today. And so maybe I'll go ahead and say I'm not a medical doctor, so I'm not giving you medical advice, but I'm going to give you a few things to think about. It might be kind of spiritual, but again, if we believe physics is true, everything has to kind of follow physics and science. So if we know everything's contained in mind, we can go from there. And so just to backtrack a little bit on the history, I said Qigong is Chinese medicine. And so Chinese medicine, as it's practiced today, as you go to your acupuncturist, was mostly established a little over 2,000 years ago as far as a system. But that system came from, we could say, the shamans thousands more years back, just doing what Peggy said, just standing under a tree. That's actually one of the practices, is stand like tree. It's called standing post. And you just stand there. And what that does, because modern society, we're so fast, everything's so fast, and the next thing and the next thing. And I think part of that's just Western culture is more and growth and, next. It's like we never stop. And so what happens when you stop and you breathe and you maybe feel the breeze on your neck. That's why I'm wearing this scarf. That's a little there's acupoints on the back of the neck called the wind gates. And so they acknowledge that if you get a strong cold current to the back of the neck, it may penetrate the system and cause problems. Chinese medicine, as we know it, came out of people just standing still, paying attention to their bodies, going within, perhaps. And when they did this, they were able to realize certain channels. So like the acupuncture channels that you see on a doll. And so much later, only much later did they decide, well, maybe we'll needle it. It started with massage. They didn't start with needles, they started with hands. And agreed, Peggy. And so we'll say Chinese medicine comes from Qigong, which is just old. And Qigong came from people that I guess just didn't have anything else to do. But there's these three treasures again: the body, the breath, and the mind. So if you've been to any of my classes, you'll hear me throughout the class get everyone to check back in. How's your body feel? What's it doing? How's your breathing feel? Is it shallow? Is it deep? Is it in the belly? Is it in the chest? And just notice. And then how's the mind? Is it racing? Are you thinking about what you have to do in an hour? Or usually once you pay attention to the body and the breath, the mind will settle. And so you need the combination of these three things. And this is why yoga and Qigong is so powerful and is the mindfulness aspect, as Peggy just pointed out, that you don't necessarily get with just going out and running a mile just to run the mile, but you can run the mile and pay attention to your breath and not have rock music blasting in your ears. So you can get the body, but you add the breath and the mind, and that's where the real change begins to happen.
So Zach, you referred to your classes, and you are nice enough to provide instruction, I guess, once a month. We send that information out from the Center for Integrative Oncology and Survivorship, and I participated in one. I would have liked to have participated in more, but there's always a conflict at the time. But it was a lot of movement. It was a lot of attentiveness to my breath. It was, very being present. Not necessarily, as you said, thinking about what I had to do or thinking about what I needed to get done today and that sort of thing. And it was remarkable how much better I felt after that. So if there's a greater percentage of integrative oncologists out there, they're taking care of cancer patients. They're helping cancer patients that are living with cancer. They're helping patients who have no evidence of cancer, but it could potentially come back. They have family members, caretakers, that are trying to live healthy and resilient lives. What is the biggest thing that you think either Tai Chi or Qigong brings to the table for that specific subset of patients? And I'll ask Peggy the same thing.
Yeah. Good question. And I think, as you mentioned Tuesday, I could talk for an hour. I see we're running out of time, but the difference, and I actually said this to you the other day, that what made it more than an exercise? And as one of my teachers, Michael Wynn, says, Qigong is not an exercise, it's a communication. And what I followed that up with is, as I've been pondering this, because one of the cornerstones in Qigong is developing more of a relationship with your internal organs. And so, I think day to day, most people don't really think about their heart or their lungs necessarily, especially if there's not a problem, or their stomach or their spleen. And so we really don't have a relationship with our organs. And, they're kind of like the overworked, factory workers. But if we can, and we can, tune into them, we can begin to affect our physiology. And I think that's just not common think here. Like, we're kind of victim to everything, but that's part of the mindfulness. And in Chinese medicine, the organs are the mind. It's not the brain. The brain is in concert with all of the organs. Brain's very important, but it's one of, 20 or 30 different little pieces. And so these all work together. And that is our mind as we know it, as we understand it. How we operate in the world is our emotions. In Chinese medicine, they're very clear which emotions come from certain organs. And so it's the paying attention to the body and having more of a relationship just with our own insides, really that separates it, I think, from just average, I'm going to go do this rote exercise, I got to do this again. It's like you said, you're constantly checking in. Okay, what's my lung saying now?
which is so different than what we're doing when we're running or we're walking. In the Western culture, it's like we have to be getting something else done.
Yeah.
So we have earbuds in and we're listening to a podcast or the rock and roll music or whatever, something that makes you inattentive to
Right.
what's actually going on. There's I know you've been keeping track here, but can you please talk a bit about the energy aspect of Qigong?
Yeah. Yeah, I know we got about a few minutes, but yeah, I want to hit some of these questions. But so as far as the energy,
This is going to be a 2-minute answer.
yeah, as far as the energy, as I mentioned earlier with Jing Qi Shen, body, breath, mind, the breath, the Qi is the energy. And this isn't just our breathing. This is the plants are breathing. We know this, stones are breathing. The stars are breathing. If you ever see Mercury, it looks like it's inhale, exhale, inhale. It's like spinning. So everything's breathing. The universe, that's the yin yang, is inhale, expand, exhale, contract. And so, again, going back to physics, all matter is merely energy condensed. So the energy aspect is that everything's energy. But Qigong and Chinese medicine, I think, have just done a very, very, very good job at mapping all of this. So that's where the Chinese medicine and Qigong gets really interesting to me, is like, man, these were some serious scientists, like, to figure out how things move. And
I speaking of scientists, there's a very well-known integrative doctor at MD Anderson. I don't think he's an oncologist, but he's at MD Anderson, which is the University of Texas Cancer Center. His name's Lorenzo Cohen, and I would recommend this book he's written called Anti-Cancer Living. Lorenzo Cohen, he wrote it together with Allison Jeffries, who's his wife. And he talked about a study that he did actually with Qigong in Chinese women that were undergoing breast radiation therapy. And the ones that practiced the Qigong that did much better from the standpoint of a whole lot of symptoms, including fatigue and energy and that sort of thing. So, clearly there's more data that's backing this up. Peggy, I'll ask you, as you've practiced over the years, are you finding that these complementary things to conventional medicine are being more accepted, not only by patients and the general public, but also by, the traditional physicians?
I do see that happening. Am I talking?
You're
Okay.
doing, yeah, you're talking.
I think I sort of handpick my doctors, though. I'm kind of particular about, I would prefer to take a jug of grapefruit up a mountain, meditate every day at lunch, drink the grapefruit juice. I would prefer all those things first, but and I hope I'm not oversharing, but I had a diagnostic breast exam yesterday morning, and I waited for 2 weeks to get in. So the whole time I'm talking about all these integrative medicines, and I'm being a speaker, and I'm thinking, what is going to be the result of that right before I give this talk? And how am I going to? And I never even told my mom that I was going for the diagnostics, because her energy is not going to be the same as I can give myself during this process. So I'm happy to announce that it's just, excuse my French, but it's just side boob. It just feels different to me because I'm getting older. But, I never have gone through the full diagnostic. I've just got my mammograms. So yes, I think the doctors, the radiologist, I actually didn't see the radiologist, the ultrasound technician, whoever she is, everybody seems to In the waiting room, I talked with 5 other women, and oh, something's happening.
You're good. You're still
Um,
on.
we all talked, most of them shared about how God had a hand in it. And they also talked about yoga. One lady said to the next one coming back, you know, that girl I just took back out there, she was doing yoga when I came in. I wish I could do that. And it's just started this whole thing. And we just took a breath together, and, you know, it's,
So let me add a little conventional medicine to this, is that you have to tell your doctor if you're drinking grapefruit juice every day.
and I don't even like grapefruit juice, really. I just
I'm
picked that as an
just saying,
example.
because it incites the cytochrome P450 and it metabolizes drugs differently. So
I
normally
know
if
people with cholesterol problems can't
you
drink
have to,
it. I
you
know.
have to avoid grapefruit when
Yes.
you're taking some of these drugs. So there are a
Thank you
lot
for
of
bringing that
people that want to know how to get a hold of you two. I know at the end of your slides, Peggy, you had your
Right.
website. Is that the best way to get, or your email?
Yeah, I don't even know if I put my website on there. I put my phone number and email, I think. Yes.
Okay, so
But
that'll
my
be
business is called Sparrow Yoga. I don't even know if I wrote that on the slide, did I? We can add that though.
all right. So we'll add that. And Zach, you want to give some information so people can get a hold of you?
Yeah, can I just put my website into the chat?
That'd be great.
Yeah, so
You guys know how to do that.
let's see, is that, yeah, so this is me. Yeah,
Yep, I see it.
yeah, I believe that's spelled correctly. Yeah, and then my information's on that website at the bottom of the page. You can call, text, or email me. I do massage and body work and Qigong here in Greenville. So you can definitely call, text, or email me about that.
So clearly we want to have access to other things besides conventional medicine to help with not only side effects, but lifestyle medicine and just living a better life. And so access to these people, and they've made themselves so available, often without any remuneration or anything. So we're very grateful for your time tonight and your time that you devote to us and our patients on times when nobody's looking. So very much appreciative. And so hopefully we'll get some referrals to you and you can help some other people with the stuff that you guys do.
And can I add a thought in closing? So I didn't get to do my full spiel, but that's okay because we didn't have time. But you know, you asked the other day if there was one thing I wanted to convey to the audience, and that is that you can heal. You're the one in the driver's seat. So, you know, if you've got a diagnosis, if you're scared about it, I think the motto was community is stronger than cancer. And I would just add that you are stronger than cancer. And if we know, again, from physics, because that's what we call science, everything is contained within that field. Everything is contained within the mind. And I could elaborate on that a little more, but you know, cancer is a little bit like, you know, cleaning out the closet. And so if you're able to tell yourself, I'm going to get better, if you're able to go into yourself and look at those hard things that you don't want to look at, that's kind of where we say it starts, is things we're not dealing with. And then the cancer grows. The body knows what's going on and the mind ignores it. And so if we can get back in there, we can fix it.
which is exactly why I didn't tell a bunch of people about my diagnostics pending, because I don't want anything manifesting because everybody else's energy can't be contained the way, or can't go the direction that I want. However, I am this alternative and medical path. And I also do not steal anyone's hope, but I read the diagnostics also, maybe differently than Zach would. And I can be very truthful about the doctor's opinion at that moment. But that doesn't mean we can't incorporate all of these things to make your quality of life and the rest of your life, whatever that, if they say there's 4 months, 5 years go by. This happens all the time. The doctor has to give, or the diagnostic person has to give their best opinion at the moment. I have a best friend, a travel friend, dying of very rare, very aggressive appendix cancer. She's never once told me how much time she has left. We just keep going on vacation. She can't go far. We go to, we were in Highlands this weekend. They got a week and we go for one night because I'm very comical to her. My husband and I go and we entertain them for a night. So she is just a wealth of positivity. And I'm sure she has lived out beyond what they've probably projected.
It may not change the outcome, but it certainly changes the journey, including how long that journey can take. It is a source of mortality, but clearly we can live with it in a better way. So I will thank you guys again and let everybody go for tonight. February is 4 weeks, so it's February 10th, and our next meeting will be March 10th. And we're going to talk a little bit about something Peggy referred to as the gut, and this will be the gut microbiome, which more and more stuff is being found out about. And you are what you eat. Again, we do that more from the standpoint of nutrition, but there's lots of things you can do to help for a healthy gut, and it helps your immune system, and it's got its own nervous system. There's just a lot of stuff there that's there to know. So we'll let you go tonight. We hope you will get out into the nature. Peggy and LC are at the Center for Hope and Healing, so get out to the Cancer Survivors Park. It's a beautiful place, and next month things will be coming up out of the ground to make it a very colorful place to be attentive. So with that, I'll bid you adieu and good night.
Thank you. Thanks again.
Thank you.